Type 2 diabetes is a significant health problem globally, and minorities who've migrated to Western countries, including the Sudanese community in Victoria, Australia, are at heightened risk of developing the condition. The treatment of type 2 diabetes, including the prevention of complications commonly arising from the condition, is significantly amenable to lifestyle modifications. Where often health and illness are only perceived and described through the lens of biology, to gain an insight into individual and population health, it's important to consider cultural factors such as ethnic identity, language, customs and traditions, and religious beliefs. To address this aim, perceptions of participants from Sudanese backgrounds in Australia and their engagement with their cultural practices were explored in order to gain insights into their experiences of living with type 2 diabetes in relation to their culture of origin and the broader Australian context. A qualitative approach using semi-structured in-depth interviews was chosen. Using multiple recruitment strategies, 12 participants, 9 females and 3 males, were recruited, mostly through community groups. The results showed a number of barriers to and enablers of self-management of diabetes. To begin with barriers, we found several personal, social and community barriers affected self-management for participants in this study. Apart from challenges like knowledge and language, which are widely cited in the literature as affecting healthcare for culturally diverse people, we identified additional barriers impacting our participants. The Sudanese is a collectivist culture where family, friends and community play a central role. Several participants saw stress emanating from family as hindering their diabetes management. For example, some respondents, like one quoted here, noted looking after their children and families presented a challenge to maintaining a healthy lifestyle and therefore managing their diabetes. Social obligations, such as entertaining guests in one's own home or going out to social gatherings, also rendered compliance with a strict diet difficult. Further, limited finances were cited by at least a third of participants as impacting their management of diabetes, particularly in regards to maintaining a healthy lifestyle. For example, they perceived healthy food to be more expensive to buy or noted they could not afford a gym membership. Traditional Sudanese cuisine was perceived to be a major barrier by the participants to maintaining a healthy diet conducive to optimal diabetes management. There are a number of Sudanese staple foods which featured prominently in participants' diets. Almost all participants mentioned asida. This is similar to porridge and can be used in the same way as rice with any main meal. Other dishes which came up included kisra, a flatbread. While doctors and dietitians often advise respondents to reduce their intake of these carbohydrate-rich foods, many found this difficult, as shown in a quote here. Moreover, most participants were Muslim and found it challenging to reconcile managing their diabetes with observing Ramadan, which involves fasting from sunrise to sunset. Although this can pose health risks for people with type 2 diabetes, the doctor's advice should take into account the patient's religious observance. To move now to enablers, we found participants benefited from the support of their doctors and social networks, while religion and traditional remedies were particularly important to them. General practitioners were the first and most frequent point of contact for all participants when they required health checks, medication or advice on managing their disease. Overall, they were pleased with the level of care they were receiving from their GPs. Participants also saw dietitians, diabetes educators, and engaged with specialist services, as seen in the top quote. The support of family members was important for many participants in their diabetes trajectory. This included spouses and children accompanying participants to their appointments and supporting them to achieve a healthy lifestyle, as was the case for this participant in the middle quote. The support goes both ways, with a number of participants, particularly the females, noting a key reason they sought to look after themselves was to remain healthy to look after their families. Religion and culture played a significant role for many participants in the way they approached and managed their diabetes. Some participants found Ramadan to be an effective way to manage their diabetes, noting their blood glucose levels were more stable during this month. Moreover, a number of participants had a daily prayer routine, such as namaz or salah, Two participants believed this was beneficial for their diabetes management because of the movements associated with the prayers. Some saw the benefits of prayer as asking God to safeguard their health. Many participants used traditional remedies to manage their diabetes. Cinnamon, which they generally drank in the form of a tea by adding the spice to hot water, was the most commonly used. 5 participants, including one quoted here, reported they used cinnamon regularly to lower their blood sugar levels. Other traditional remedies mentioned were helba or fenugreek seeds, mahogany bark, and Arabic gums. Thematic analysis of our results suggested participants' constructions of disease management were inextricably tied to the expression and maintenance of their cultural identities. While the majority of participants were aware of the measures they needed to take to manage their condition, self-management strategies were difficult to implement and maintain when they were not compatible with Sudanese culture. The difficulty of maintaining cultural identity whilst implementing Australian self-management strategies came through as the most significant barrier. This highlights the need for culturally appropriate provision of health services and resources for Sudanese patients with type 2 diabetes. Future studies evaluating the effectiveness of culturally appropriate programs are required to improve engagement of people with type 2 diabetes among the Sudanese community.